Hello, guys. Welcome to Heaven and Health podcast. Enjoy with me, Angel Polido. In our today's episode, we'll be focusing on the healthy matter. So, joining me is Wells Micah, a rehabilitation technician who will be basically giving us an insight on physiotherapy. So, be with us along the way and get an insight on everything concerning physiotherapy. So, Wells Micah, you being one of the rehabilitation technicians in Malawi, will you tell us more about yourself?
All right, my name is Wells Micah. I'm a rehabilitation technician who got training from Medical Rehabilitation College, popularly known as Kachele. Yeah, I'm a rehabilitation technician. Sure.
Okay, so when you basically talk about physiotherapy, what is it referred to or what is it all about?
Okay, let me start with this. Maybe people may be wondering, this person is saying is a rehabilitation technician, medical rehabilitation technician, and you're asking about physiotherapy. How does it connect? Okay, the thing is, the main thing is rehabilitation science, medical rehabilitation. So in rehabilitation, we have three broad categories. We have physiotherapy, we have occupational therapy, and speech therapy. So I just wanted to clarify there. Maybe people may be wondering, you're asking about physiotherapy, and this one is rehabilitation technician. How does it? So within rehabilitation, there is physical therapy, occupational therapy, and speech therapy. Yeah. So you have started with asking the benefits of physiotherapy. So physiotherapy.
I was asking what is physiotherapy all about.
I think you edited that.
Yeah.
Okay. So physiotherapy, it's like I said area that it's a part of rehabilitation science, which mainly focuses on the improvement of the ability of the people who have, we say, impairments. Those people who have impairments who have functional disabilities.
Yes.
So I can, in simple way.
Functional disabilities, like maybe other parts aren't working properly.
Yeah. So you can say it's trying to improve the ability of a person who has gone under injury or a certain condition. For example, stroke.
Yes.
Yeah. A spinal cord injury and the other musculoskeletal conditions. So when a person goes under that condition or injury, so we people that would do rehabilitation or physical therapy, we try to bring to improve the ability after that injury or condition. Yeah, so that's basically about physiotherapy.
You said you also deal with speech physiotherapy. So how does physiotherapy differ from other forms of rehabilitation?
Okay, yeah. So as the name suggests, speech therapy, occupation therapy.
Yeah.
So physical therapy differs from these. Mainly, I've talked of physical therapy like focusing on the physical ability of a person. How does the muscles work? How do joints work? So physical therapy focuses on those areas to improve the ability, the structure of a human body. Understand?
Yeah.
Whereas occupational therapy deals or focuses on the improvement of the performance of activities of daily living. In short form, we call it ADLs. When we talk about activities of daily living, we are talking about the simple activities like washing, feeding, or toileting, and everything that you can think about being an occupation. Understand? Whereas the speech therapy deals with the training of communication.
Yeah.
Training a person who has gone under condition, or let me just say condition.
Where he or she is failing to speak.
Yeah. So he's failing to speak. So you come in and train that person to communicate properly.
So do you start over like teaching this person the alphabetical letters, or what's the conditions? What's the condition like?
Okay, all right. When we talk about the conditions, we can talk about the children's disorders that we focus on. For example, we have cerebral palsy. In short, we call it CP. There are some children who present with like we can say aphasia.
Yeah.
That's inability to speak. So they can present with aphasia. There are other conditions like which we see in the rehabilitation department, like autism disorder. Yeah, so those children, they may present with the difficulties in speaking. So it's the responsibility of a speech therapist to train, to assess and to see the proper plan or the proper training, the proper treatment that he or she can offer to that person.
What about if it's another person?
Yeah, in an adult, we can mainly talk about stroke. In some scenarios, or in some like other strokes, people may present with aphasia.
Yeah.
As I have already indicated, that's difficult in speaking. So if they present with aphasia, you take him to a speech therapist. So based on his or her assessment, he can see which way or which is the proper treatment for that person. So like basically they can start with all muscles training. They use balloons to train the person, like to how to inflate the balloons. Yeah, and so on and so forth. Yeah.
So from what you have saying, what are the most effective physiotherapy techniques for specific conditions or injuries?
Okay. I may say all the techniques, all the treatment techniques that we use, they are effective. They are effective. Let me just outline them for you. We have broadly, we can say we have techniques like manual therapy. Manual therapy, that's a treatment technique that we use our hands. So in manual therapy, we have joint range of motion exercises. We have muscle strengthening exercises. We have massage. We do also massage in the manual therapy. So apart from manual therapy, we also do electrotherapy, which involves the use of like the electric devices. For example, you can talk about TENS, that is transcutaneous stimulating, nerve stimulations. Yeah, so TENS. We can talk about infrared light. We can talk about interferential stimulation therapy. Yeah, so those are like the treatments that we can use. Apart from that, we can talk about cryotherapy and the thermotherapy. Cryotherapy, we use ice or cold packs. In thermotherapy, we use the hot packs or warm water. Yeah, so those are like the main treatment techniques that we use: manual therapy, electrotherapy, and cryotherapy and thermotherapy. Of course, in other terms, they can categorize cryotherapy and thermotherapy under electrotherapy. In some studies, they have shown so. Yeah.
So what do you think can be the impact of exercise in physiotherapy?
The impact. Okay, the impact in physiotherapy, the impact of exercise in physiotherapy is so we can say exercise, not mere exercise, but therapeutic exercise. What do I mean when I say therapeutic exercise? When I talk about therapeutic exercise, it's not just an exercise. You don't just do exercise for the sake of doing it. No. But you do it with a specific goal and with we can say it should be timed.
And what type of exercise do people do?
Okay, like the therapeutic or exercise.
The therapeutic exercise.
Yeah, the therapeutic exercise. We talk of muscle strengthening exercise. Yeah. So muscle strengthening exercise can involve us using a different kind of materials. For example, we can use a stationary bike. When somebody is cycling, we are training or we are strengthening the muscles in the legs.
Yeah.
Sure. So we call them lower limbs, or we can call them legs. So it's fine. So when a person is cycling, we are trying to increase the strength in the muscles of the lower limbs or the legs. We can also use therabands. They are like kind of rubber bands that we use, which have they are elastic, but they are tensile,
which help the muscles.
Yeah. So when they are like trying to stretch, they are strengthening the muscles. So muscle strengthening exercise, it's one of the exercises that we prescribe as therapeutic exercise. So we don't just do. No, we have to give them like how many repetitions, at what time should you stop. So we call them therapeutic exercise. Another one we can talk about gait training. Gait training, it's we are training a person how to walk.
Like as if he or she is a baby?
Yeah. So if a person goes under a condition, you can't expect him or her to do the things
normal things. Yeah.
So we try to teach him, to teach her.
Mind if you can share some of the steps you teach this person to start walking?
Like the steps.
Yeah.
Okay.
Maybe just in brief.
Generally, we start with the assessment. The assessment, we assess the strength or the muscles, the upper body and the lower body. Is this person able to stand? If the person is unable to stand, we can't train him how to walk. We can't train her how to walk.
So if the person is failing to stand and walk, that means he or she will be using a wheelchair for the rest of his or her life?
Not really. Okay. If the person is failing to stand, so there are some. Okay. Basically, when a person suffers, we assess from the activities. We can start from the bed. Is the person able to turn in the bed? If the person is failing to turn, we know that there is a need for us to train him or her in bed techniques, in bed mobilities. Is the person able? Okay. Is the person able to transfer from the bed to the edge of the bed? If the person is able to transit from the bed to the edge, we say, okay, that's fine. If he is failing, there is a need for us to train that person. Is the person from there? We assess the sitting. Is the person able to sit? independently without support. If the person is able to sit, it's fine. It doesn't end like there. So we see the balance now. The balance, is it okay? Okay, it's okay. Okay. So we assess the standing. Is the person able to transit from sitting to standing? If the person is failing, there is a need for us to train that person to stand, like sitting to stand. So those exercises we call them sit to stand exercise. Simply, we are training him to transit from sitting to standing. Yeah. So there are a lot of steps to lead to the walking training. You see, so if the person is able to do all these things, and we have assessed that he has the ability to stand, now we can proceed to train him in walking. So we don't just start with the like making him or her to walk on our own. We use bar or bars, which the person hold hand, or each hand. There
To
are
support
some,
him.
yeah. So for the balance,
Yeah.
we train him using the power bars. From there, we can proceed to using we call some equipments low ladders or walking frames. From there, we can use clutches, both clutches. If the person has attained or has improved, we can later go into what? Using a single clutch. If the person is able to use a single clutch, we can proceed to using a cane. You see? So it means that if the person improves with a cane, we can tell him or her to leave the cane and start walking. You see? So basically, that's what we do.
So from what you have explained so far, the effective techniques, the steps that you treat a person so that he or she may be able to walk again.
Yeah.
Are there any misconceptions in physiotherapy?
Yeah, they are. But I'll just highlight 2 or 3 misconceptions. The number one misconception about physiotherapy, it's about people think that physiotherapy is not worthy. What do I mean? People think they can do physiotherapy on their own, which is a total lie.
Yeah. They still need the help of the doctor.
Yeah. So doesn't mean that you have just seen the exercise that we do. It doesn't mean you can do on your own. No. There is a need, because we went into class for this.
Yes.
We have knowledge, and we know, okay, if the person is moving like this, okay, what is happening there?
Yeah, and what is needed?
What is needed? We have knowledge about that because we went in class.
Yeah.
So some people just think physiotherapy it's
so
it's simple. I can train. I can do on my own. No. There is a need for you to have a physical therapist. So some people think we can train this person. I saw somebody doing this. No, you may end up injuring that person. So that's misconception number one. People think they can do physiotherapy on their own, which is a total lie. So there is a need for us to be to be incorporated in the treatment. Misconception number two. People think that physiotherapy it's about exercise. I was chatting. I had a client. So based according to him, physiotherapy was about exercise. So I was asking him of his condition. He came with the knee pain. So I was asking him, what do you do? Say, I do exercise. So I just need massage therapy. What? So I said, you need, okay, I can tell you that you need massage therapy, but you also need physio. We do, generally, you need physiotherapy. He was saying, I do, I like that stationary bike, I cycle. So I was like, no, my friend, physiotherapy, it's not about exercises. No. Physiotherapy, as I've already talked about the techniques that we use. We use the massage therapy, yes. We use the exercise, yes. We use cryotherapy, the use of ice. We use thermotherapy, the hot packs, and the warm water. So people just think physical therapy is about exercise, running, jogging, doing whatever. No, that is not a physiotherapy for you. Physiotherapy, it's a broad thing. Involved exercise, and we don't just say exercise, mere exercise. They are therapeutic exercise. Exercise, massage therapy, cryotherapy, electrotherapy, and thermotherapy. Yeah, that's misconception number 2. People think that physical therapy, it's about exercise, which is not true. Another misconception, which I can say it's the last one in our discussion. People think that physical therapy is painful. So many people shun the treatment, or they run away from the treatment of physical therapy because they see that physiotherapy, it's painful. Or some people, they say physiotherapists, they are cruel. They are cruel people. You see? So, which is not true. Okay. Our like goals, our aims in physical therapy or rehabilitation. Number one aim is to manage or to reduce or to bring relief to a person who has pain.
Yes.
So our main aim is to relieve pain. So it's not to cause or to hate somebody. To cause pain. No.
The pain is already there. And
the pain is
helping
there.
that person to recover.
To get well. So we use cryotherapy, we use thermotherapy, we use electrotherapy to get rid of that pain. Not to cause like more pain, to worsen the pain. No. That is not the intention of the physiotherapist or any rehabilitation personnel. I'm talking about physiotherapists, occupational therapists, or speech therapists. No, they don't have intention to bring pain to somebody. Yeah. So that was another misconception that I observed. Yeah.
So normally you have helped a person, like maybe he or she had a muscle cramp or something like that, and he had difficulties in walking and maybe in talking. So how do you measure the progress that comes in physiotherapy?
Okay, in physiotherapy, we call them outcome measures that we use. We use them during assessment. And to see if there is any improvement, that is the progress. So we use them. For example, we measure pain using numerical rating scale.
And that is
that is an outcome measure. It's a simple outcome measure. You have numbers 1 to 10. 1 means that there is no pain. There is no pain. 5, figure number 5, it means that the person has a pain, but moderate one. But coming from 7, 8 up to 10, the person is in pain, in severe pain. So we ask the client or the patients, how can you rate your pain?
So the patient chooses the number.
Yeah. So if the patient says my pain is on 7, so it tells me as a rehabilitation technician or physiotherapist the treatment that I'm supposed to give, and the intensity of the exercise, the intensity of the treatment that I can give. So if the patient says it's on 1, it means I can the intensity, I can intensify the exercise. But if a patient is complaining of pain, it means the exercise or the treatment technique will be not vigorous, or the intensity will be low. You see? So we use numeric rating scale. There is also this scale, which is called, in simple terms, is called FLAC scale. So FLAC scale, we normally, like in my training, we used it in Bain's ward. As we were using FLAC scale, F, that is for face, we see the face, how does it a person look like. L, it's for legs. A, it's for what? I've just forgotten, but it's an abbreviation.
Yeah.
So you check for the legs, for the face, the activity. A, it's for the activity. The C, it's for cry, and another C is for consolation. How does it take for the patient to be consoled? Some patients, some children may take 5, 10 minutes or 20 minutes to be consoled, to stop crying. So we assess pain using FLAC scale. Face, legs, activity, how active is the person, the cry and consolation. So that's FLAC scale. Another thing, we use manual muscle testing, MMNT, or others we call it Oxford scale. So this outcome measures the strength in your muscles, the muscles in the arms, in the legs. So we use this outcome measure. So it means when I start the treatment, I'll be using the muscle, the Oxford scale, or the manual muscle testing scale. Okay. At first, I saw that your muscle strength is 3 out of 5. So as I'm doing treatment, I'll be assessing the strength.
Like, is it increasing or decreasing?
Is it increasing or decreasing? So I will check. Okay, the patient is improving. Is on 4 out of 5. Okay, I'll be using manual muscle testing scale, or Oxford scale for muscle strength. Another outcome measure that we use, it's a functional independence measure. It's FIM. In short, we call it FIM. So this outcome measure measures the activities of daily living. For example, walking. What is the support that he or she needs in walking? What about sitting? That's an activity. What about bed turnings, bed mobilities? Is the patient able to turn in the bed independently or needs a support? So we use FIM. It has some numbers. we
Just
can
like the other.
yeah. So yeah, we use functional independence measure to measure the functionality of a person. Yeah. So like the progress during the assessment and the progress, we use these outcome measures. Yeah.
So for someone who is listening out there, what can you tell this person the benefits of physiotherapy?
The benefits of physiotherapy, they are, I can just broadly categorize them as this. Physiotherapy helps to improve the impairments. What do I mean when I say improve impairments? In physical therapy, we indicate pain as an impairment. We indicate reduced range of motion, that is on the joint, as an impairment. We indicate muscle weakness as an impairment. So basically, what do I mean when I say impairments? They are those things that are limiting somebody to do an activity. Pain can limit somebody to do an activity. Muscle weakness can limit somebody to do an activity. Reduced range of motion on a joint can limit somebody to do what? To do an activity. So physical therapy helps to improve those impairments, helps to reduce pain, helps to strengthening the muscles, helps to improve range of motion on a joint. Helps to improve balance and coordination in somebody who has gone under a certain condition or injury. You see? So those are benefit number one, improves impairments. So those are examples of impairments that I've highlighted. And another main benefit is that we increase the participation. Physical therapy increases the participation of a person or an individual in activity. You can agree with me. If a person is sick, for example, has stroke, it's difficult to tell him or her to participate in a certain activity.
Yeah, he'll be having
difficulties. Yeah. So when we are trying to improve these impairments that I've highlighted earlier, pain, reduced range of motion, muscle weakness, balance and coordination, if we have tried or we have improved them, so it means that the participation in activity in this particular individual will increase. So we help to improve the participation in activity in a person who hasn't undergone a certain condition or injury. So mainly benefits, improves impairments. What do I mean? Reduction of pain, muscles, improving muscle strength, improving balance, improving coordination, and also bringing or improving the participation in activity in these particular individuals.
Thank you very much, Wells Micah, for coming in our today's episode, and we appreciate very much. And if you're one of the people who are out there, don't hesitate, go to the hospital. When it comes to physiotherapy issues, we have already heard that it's an issue which basically people think that is just something simple they can do on their own, but it's not something that simple. So if you're having difficulties in walking or difficulties in anything, don't hesitate, find your own therapist so that you can get help out. Thank you very much for listening.